Hello friends, let's today talk about the cementless total hip replacement. Normally there are three types of hip replacements. One type in which we do not use cement for fixing the components. Second type where we use cement, and third where we partially use cement, or we say it is a hybrid sort of fixation in which one component requires cementing and the other one is done without cement. Normally, when we talk about cementless fixation, it is done for younger patients having good bone quality. Primarily, it is indicated for primary arthritis or arthritis secondary to AVN, that is avascular necrosis. But the bottom line is the bone quality should be good and there should be adequate metaphyseal bone for giving a stronger hold. The aim is to preserve bone for future surgery if required. For a revision surgery, if we are not having enough bone, then revision leads to invariably poor results. But when we do primarily a cementless hip replacement surgery, for revision, we normally have a good bone stock, so the second surgery also becomes successful if required. In elderly patients, osteoporotic patients above the age of 65, especially females, we normally go for cemented hip replacement surgery because results are better, mobility is fast, chances of periprosthetic fractures are less, and overall the complications are less, life is better after the age of 65 if we do cemented hip replacement. When we talk about uncemented hip replacements, the national registry or the literature data shows that almost 10 to 15 years survivorship is more than 90%, which is a good number. Slightly higher chances of periprosthetic fractures are there in case of cementless fixation, but that is higher if at all we do it in marginally osteopenic case or patients with osteoporosis. In that also there are certain type of designs that play a role, like collared stem we are using or collarless. But overall, after a certain age, we normally never prefer doing cementless fixation for hip replacement. There has been a recent trend talking about hybrid fixation where the stem, the femoral stem is cemented and the acetabular component, which is the cup, is uncemented, and it has been giving good results. So it has been gaining some traction around the world. Now when we talk about the types of uncemented hip replacement, let's talk about the femoral designs. Now these designs of the femoral stems, they also play a role to certain extent. Like if we are using a tapered wedge, basically a metaphyseal filling stem, or if we are going for a diaphyseal fit. Sometimes we use short stems, neck sparing, which is a good bone preserving technique, and this has also been gaining some traction recently. Now the basic idea of using a cementless hip fixation is the bone should grow into our implant. So for that, various techniques or various options are available, like porous titanium or tantalum implants are there. Basically these are trabecular metals, or sometimes we coat them with hydroxyapatite also, so that to promote the bone ingrowth into our component. This basically leads to the strong fit between the component and the bone. Similarly, for acetabular components also, we have porous cups and we use screws to fix it. It could be ceramic or metal or polymer based. It depends on the design of what kind of implant we are going to use. So practically speaking, cementless hip fixation is for young people with good bone quality. Normally for older patients, especially above the age of 65, females, osteoporotic, we never use it. In borderline cases, we can use it, but with a collared stem, and we prefer not to do undersizing, and we tell the patient very clearly that you need to be careful if you are using a cementless hip replacement in a borderline case. But patient factors are also equally important. When we talk about patient's factor, I mean the factors that you can modify to make sure that your hip lasts long and really long. When we talk about patient factor, age is of course one consideration on which your doctor will counsel you. Secondly, you should keep your weight low. You should keep your BMI or your weight as low as possible so that less stress comes onto the implant. If you are a diabetic, you should definitely control your sugar well. If you are into the habit of smoking, you should avoid smoking at all cost. So these factors you can control. Otherwise, surgical techniques, component positioning, what kind of stem your surgeon is going to do, these things you should leave to your surgeon. If you trust your surgeon, you should go ahead with his decision, and you should work on your factors like controlling your weight or sugar or smoking. I hope this video was useful for you. If you have any doubts, you can contact us on the number shown. We'll be happy to help you. Thank you.